Starting in just a minute. All right, we're going to go ahead and get going. Welcome to our third weekly webinar on preventing the spread of COVID-19 in Palm Beach County and really doing what we can to make sure that people are not falling through the cracks as we do this. We have maintained essential services. Just to give you the overall format, this will be a 60-minute webinar. We don't expect it to run as long as the last one did. Maybe a few minutes over, just depends on how many questions you guys have. You can use the chat button to ask your questions, and we'll be monitoring that and answering them as we go along. I would ask, though, if you have questions specific to health, that you ask those as quickly as possible, because we want to make sure that Dr. Alonzo, who's here at the Emergency Operations Center, that she doesn't have to stay the whole call if she's called away. So it's important to go ahead and get those questions in up front while she's here. In addition to that, if you're having technical difficulties, we ask that you would just try to use Google Chrome. That typically will help in utilizing this platform. And many people are working from home, so we have a way of muting your phones, but if you simply call in, then that might be problematic. So just make sure that your phones are muted if you're just calling in. And usually we get these webinars up the next day. We like to give ourselves 2 to 3 days, but they are recorded. If you go to our website, you'll be able to access these recordings. So today we're going to hear again an update on where we are with COVID-19. We'll have an opportunity to get an update from CareerSource and some of our other community partners, and I'll provide you with an update along with Taruna, if she's ever able to make it on things that we're doing as a department to make sure that services are maintained, especially those emergency services, because there's been some progress in that area. I like to make sure that people kind of know how we're operating. So for those of you who were not a part of the call last week, we're scheduling these calls as a function of the Human Services branch at the Emergency Operations Center. We're constantly getting updates on what's happening with COVID-19, new information about what we need to do to prevent the spread, and developing strategies to get people tested, to isolate them, and to monitor them so that we can slow the spread. And that function falls under the Human Services branch. And we work with mass care, is usually the shelters that are stood up during disasters, but we don't have shelters this time. We have isolation rooms that we are utilizing. And so just know that that is one of the functions, along with health and medical. And so know that the health and medical unit, they are monitoring everything related to our hospitals, what our bed count is, what the ICU count is, how many ventilators we have, the PPE, the number of days, and the burn rate for PPE. So health and medical, they're communicating with all of our hospitals and emergency rooms. We're also coordinating with all of our nursing homes and assisted living facilities. And so this particular unit, who also intersects with emergency services, they're constantly busy, and they have plenty of things to do each and every day in this crisis. And we're learning and documenting those things so that we'll be better positioned should we have to deal with this in the future. So that is a part of the Human Services branch. Food and water, that's a really, really big operations. I get so many calls about food and what we're doing to prepare our most vulnerable for our most vulnerable populations. So Julie Creepo will be providing an update on food. And then for animal services, we're just now starting to hear a little bit. Usually during hurricanes and disasters, there's a lot of activities around animal services, but not so much now in this pandemic. And so, but that is a function of the Human Services branch, along with special needs and making sure that those individuals are cared for, and unmet needs. We work with United Way and some others on volunteer, for people volunteering, and for making sure that donations that are coming in for people in need, that is organized. And so the Unmet Needs Committee has been active in terms of collecting volunteers for this pandemic. And now we're just going to jump into the data. So I'm going to turn it over to Dr. Alonso, and then she's going to give you some updates.
Good afternoon. Thank you for everybody being here. You're my heroes out there in the community doing all the work and doing all the legwork. So thank you for everything that you're doing every single day. We're really getting prepared here for what we are hoping is going to be the peak of the epidemic. So we're working very closely, like James said, with all our community partners and especially our facilities to make sure that we can stay on this curve and that we can stop the spread of this virus so that we do not overwhelm our hospitals, our facilities, and everything else that keeps our community going. So thank you for all the work that you're doing, because you're very much a part of this. As we look at our numbers, and you can see, they can see this screen, right?
Yeah, they can see this.
Okay. You can see that in the country, we have 432,579 confirmed cases. We've had 14,000 plus deaths, and that is quite a number. We're preparing for the worst always and hoping for the best. We do not want to be New York or the Tri-County area there, but we know that Southeast Florida, Region 7, is a hot spot. We have so much international travel and so many people visiting us that it's very important that we stay completely updated to make sure that we are ready for anything that can happen. So help me again, give me the next one. For Florida, you see these numbers. You see that we have 16,000 total cases with 2,000 plus hospitalizations, 354 deaths. Now, it's important that you know that these deaths are cumulative, right? And the hospitalizations doesn't mean that we have that number of people in the hospitals. It simply means that through the time we've had that many people in hospitals in terms of going through the hospitals with COVID. That doesn't mean we have that number of people. That's important. They made a note on the data sheet so that people realize that. This chart down here that you see, let me see if I point to it.
Here,
you point to it.
Or you want me?
No, because then I'll mess it up. So this right here to me is very, very important. I am hoping, I'm keeping my fingers crossed, I'm very much an optimist, that this curve that's going up is actually going to start coming down. If this is our peak, we're in great shape. We may see this peak continue in the next few days and then start coming down. They're modeling that our peak is going to be in the middle of April. So that means that this would have to continue going up and then start coming down. We'll see. This to me is looking like perhaps we're getting ready to start coming down. That would be a very good thing. But we can never depend on that, right? So we're going to keep looking right now in Florida, in Palm Beach County. We have 1,260 total cases. Most of those are residents of Florida. We have 2 that are not residents of Florida, 2 people that are not in Florida at all, and we have 40 of the 1,218 that are not residents of here, but they are in Palm Beach County. You can see, we can also break this down by age range. We can break it down by men and women. And we have down here the number of deaths. Oops. The number of deaths, which is 73, and the number of hospitalizations. The important thing in all this is to start looking at our next slide.
So you click left, right.
There you go. This is our testing, right? So you can see that our little circle in West Palm Beach is much smaller than Miami and Broward. Obviously, they've been testing a lot longer, but we have significant number of tests that have been going on now since we started the two sites. The one up at the Fit Team baseball park being run by the healthcare district. They've done a phenomenal job. And then the one down in Delray at the Civic Center that has just started for the past 3 days. We're hoping that down south they'll be doing up to 250 tests per day, and the healthcare district is doing quite a bit more. Both of these appointments have to be by appointments only. People have to call, and they stop taking appointments once they're full for the weekend until they get more samples. So people have to call in again if they haven't gotten an appointment to get on that schedule again. So far, we have a positivity rate of 18%. That's quite higher than Florida. For the whole state, the positivity rate is around 10.6%. Why is that way? Well, because we just started testing, and so we're testing people that have symptoms. That's very important. Not every place is doing that. We have lots of other places around the state that are just testing people without symptoms, and there's a lot less tests. So if you add the whole thing up, the state of Florida has a lot more tests, and the positivity rate is lower. We also have one of the questions that I've been asked over and over again is, why is our death rate so high in Palm Beach County? And I have the number of deaths that we've had. The last one was 69 deaths out of the 1,224 cases that we have. That gives us a positivity death rate of 5.6 versus Miami, who has only a 1% death rate. There's several factors that affect that. One is that our population over 65 is 23.9% versus Miami, it's only 16% of the population is over the age of 65. We also have a lot more people coming and retiring down here. We have a lot of the people from up north that come down, as you know. We have huge congregate living areas in Palm Beach County. We have huge condo areas, but they're living very close together. So what this puts is all this vulnerable population of over 65, and some of them, the average age for the medical examiners of people that have died from COVID is 78 years old. So we have a much, much greater population than Miami or some of these other places that have a lower death rate. So a combination of all those things makes our death rate higher. It's been consistently higher, so I'm not afraid that there's anything crazy going on. There's no cluster or anything like that that's causing this. It's just that rate has been high since the very beginning. This is a chart that we're keeping. I'm sorry, the numbers, is that thing covering their chart? No, the chart is saying, okay. It's hard to see, but the little orange on top is how many new cases we have each day. I think this is the most important part. When we started early in the beginning, let's see if I can forget which one is the one that makes the arrow. Here it is. There we are. This is when we first started. We actually started much earlier, but I cut this so that you guys can see the numbers better. We start in the middle of March. You can see that the numbers were increasing very, very slowly. This is called a linear increase. That means you're going along on a line. when things start doubling or tripling or quadrupling, you call that an exponential growth. That is more what's happened in New York and somewhat in Miami. But when you see here, as we get into these numbers, some of the numbers actually started going down from 71, it went to 65, then it went up a little bit, then came back down here on April 1st, went down to 59, and then it did a double. This is right around when we started testing. So we knew we were going to have more, but we started getting a little concerned. Were we really going to find this huge increase? So then it came down, 99. It went down again, 87. And here we were starting to do a happy dance, only 49. So for 3 days in a row, we had a significant decrease in the number of new cases. Then it went up a little bit to 65, and now it's come down last night, went down to 61 again. So that makes us feel somewhat optimistic that we're either getting close to the top of our curve, or that we will actually see this starting to slow down. So we're going to keep a very close eye on that. We're also keeping a very close eye on the number of beds that we have available in the hospital to make sure that our capacity to take patients doesn't get to where it overwhelms our medical system. That's the situation in New York is in. New York last night had 779 deaths in one day. That's overwhelming for any city to take on that many deaths. Our medical examiner right now has 2 trucks in case they get overwhelmed with the number of people coming in, bodies coming into the morgue. So that's a very sombering situation to be in. So we have to keep a very close eye on that. It's slow to do it. Only James can make this thing work. I broke it. Okay, there's my there is my line. So you can see the yellow line is Miami. You see how much sharper that goes up versus Broward and Palm Beach? We have a much slower slope. That's a good thing. So we want to maintain that. And again, very important, that's what we call flattening the curve. And we hope that we're at that bottom point where we can keep that as level as possible as we go into the rest of April and into May. So very closely monitoring all those things. You will hear that we opened up, or that we will open up, a mass casualty field hospital. We're doing that at where we would usually have the special needs shelter. That's not because we're expecting to do it, but because we have to be ready in case we need it. You cannot set one of those things up overnight, so we have to set it up before we need it. And as always, we prepare for the worst and hope for the best. So hopefully we will not have to use it, but we obviously have to be ready. So I don't want people to be scared about this. They should be glad that we're being proactive and thinking ahead to make sure that we have it ready in case we need it. Okay, the one last slide that I have has to do with what we can see in our municipalities. And you see the darker the numbers, the darker the shade, that the southern part of the county, the Boca Del Rey area, and then up in West Palm, up in this area, those are your darker areas. So you're going to be seeing some messaging. We're going to be doing even maybe some reverse 911 calls to warn the people, basically to stop the spread of COVID, to stay home, stay 6 feet apart, and wash your hands. We're going to try to be doing some of those messages. If we do some reverse 911s, I might be the one talking on there. It depends. If I know the problem with that is that a lot of people don't have home lines anymore, so we don't want to waste calls, but we definitely want to do whatever messaging you can do, or that you can do in terms of the populations that you're serving. please put that message out. Just very simple. Stop the spread of COVID. Stay home, 6 feet apart, and washing your hands. You may also hear some of the counties talking about wearing some kind of face cover when you go out into the community. That'll be another message to spread out. We're working also on the demographics. This is some of the data that we have in our report that's online. It's on the floridahealth.gov website. You can see the age, and you can see down here on the 65 and over in terms of the hospitalizations, how big this group is. That is, again, part of the reason that we're having that 5% mortality rate that other counties don't have. And here is where our deaths are really high in the same group of, the average age of the medical examiners is 78 years old. So that's where we're seeing this big 33% and 27%. So if you add all this up, you see that this is where the folks are really dying. This is you've heard the conversation in terms of the brown and black communities being overburdened by the disease. As all diseases have happened, it hurts most those who don't have adequate health care, who are underserved, and who have higher comorbidities, especially for this disease. The hypertension, diabetes, obesity, all those things are affecting people with COVID. And so we are looking closely. In Palm Beach County, those numbers don't seem to bear out like they have in, for example, Louisiana or some of the other states, but we're going to keep very good track of this. And I am doing some data with my own data that I have here in Palm Beach County to make sure that our data is accurate here and that we can reach out to our most vulnerable populations and make sure that we keep them safe. So do everything you can to have this available in other languages, Spanish, Creole, anything else that you can do and reaching out to the communities that you already do to make sure that they get the message and that they're hearing this and they're hearing how to protect themselves and the symptoms and how to protect themselves and keep themselves safe. This is just a little bit about where you have the telephone numbers here for both the healthcare district and the Cleveland Clinic. Again, you must call in order to get the appointments, and they will pre-screen you on the phone and make sure that you have symptoms. It's a little bit different category. The Cleveland Clinic is taking 65 and older with symptoms, but they're also taking 61 and older if they have some additional problems, conditions such as their cancer patients or immunosuppressed or on therapies and so forth. They're taking those 61 and older. The healthcare district does not have an age limit, but they have to be symptomatic. So that's the difference between the healthcare district and the Cleveland Clinic. In addition to that, we also have a kind of express lane for our first responders. It's very important that we're able to test them quickly because they are a significant force that we need to have them get back to work, make sure that they're tested right away. So both of these centers will continue taking the test. It's free to get tested. We're working as hard as we can on the rapid testing. Some of the hospitals are actually using that in conjunction with the regular testing. But make sure that people understand that if they're not symptomatic, and I think this is very important that everybody listen to this, if you're not symptomatic and you get tested, you may get a false negative because you don't produce enough virus in your body until you start showing symptoms. So you get that test and it's negative, you just know you're negative for that moment that you get that test. You go out and you can come in still in contact with somebody, or you simply are getting tested too soon before you develop the symptoms. That's why it's so important that these sites are both testing people who have symptoms. And we're going to be testing as long as we have supply to do the testing. So those two sites are going to continue doing that. We want to keep people isolated, make sure that they contact their provider. You don't need a provider And if you don't have a provider and you need testing, again, you can go to the 2 sites. There are the telephone numbers. But if you are symptomatic and you can't get tested for whatever reason, or you don't want to get tested, then you need to stay home for the 14 days taking acetaminophen. There's been several articles that came out by Tylenol company saying that that was a misnomer about ANSID and these other things being dangerous, but we're saying take acetaminophen. If there's a fever, you need to drink lots of water and get rest. There is no medication for this, even though you hear people pushing for certain drugs. Those are experimental at this time. And when the condition worsens, that's the time to go to the hospital. Don't go to the hospital if you're just having the normal cough and fever, that you need to stay home and take care of yourself that way. The hospital is not going to treat you unless you're really going into having difficulty breathing or needing further testing.
Okay, so
Let's see what questions we have up there.
are we able to track infections and deaths by age?
Yep, you saw that on the tracking, and there's 2 places. If you go to floridahealth.gov, flhealth.gov, there are 2 sections. One is called the dashboard. That's the one that has the Florida maps and everything. And the other one's called the report. The report is the one that has the demographics and some of that information that you're looking at. And they fixed up some of our data that we had here in Palm Beach County.
So that's the only question that I see so far. If you do have additional questions, you can use it. You can use the chat button to ask. So we're going to just continue on until we see additional questions.
Okay. Thank you very much.
All right. So what I'm going to do now is just share a little bit of information about what we're doing to make sure that we're looking at this from an equity lens, from a racial equity lens. And I think Marcia is on the phone. I don't know if she can unmute herself, but I just want her to talk a little bit about what we've been discussing and how we are looking to approach this work and looking at it from an equity lens. Dr. Alonso, when she went over the demographic data with you, talked about some of our strategies to go out and do more testing in communities where we're seeing the disease being more prevalent and isolating, and really looking at racial demographics to determine how we can use that data to make decisions. So Marcia, if you're able to chime in and just to talk a little bit about some of the things that we're doing, please take the moment to do that now. And then I'll go into some specific information about how we can better prepare the most vulnerable populations for stimulus checks and things of that nature.
Thanks, James. Good afternoon, everyone. I'm Marcia Guthrie. I'm Community Planning and Partnership Lead at the Children's Services Council. And I also, in that role, support the implementation of our Youth Master Plan with Birth to 22, United for Brighter Futures. And so Birth to 22 is an alliance of community partners who are looking collectively at how we can improve well-being for children and families within Palm Beach County. And as such, we bring together a diverse set of stakeholders to think about well-being, and so well-being broadly, from education to health to career, so on and so forth. And in our conversation, we have been thinking about not just where we are currently in terms of the pandemic, but what are the things that we're going to need to have activated with post-coronavirus. And recognizing that not only do we need to plan for right now and keeping people healthy and safe and alive, we need to be thinking about what is the long-term impacts of this virus on our communities. And specifically, when we're taking an examination of what's going on, how do we have a better understanding of who is being impacted, what rates, how are their well-being outcomes being further challenged by this pandemic? Do they have access to supports at the rate of others? And so I was quite pleased to see that Dr. Alonso shared that here in Palm Beach County, we are at least are collecting data. And so we have information on who is getting infected by race and ethnicity. We can track deaths by race and ethnicity because you can see from the slide that James has up, some states have moved in that direction, are able to get that information, but many are not. And so if we're going to think about how do we target messages, how do we ensure that particularly the Black community understands that we don't have some innate things in our bodies that serve as an antibody for contracting corona. There's been a lot of false information out there that Black folks can't get it and Black folks won't die from coronavirus. And we are seeing across the country that that's not true. And so along with our community partners, we have activated a GAP task force work group through Birth of 22 that will be kind of examining what are the gaps. We've done our response systems have been in place in the last couple of weeks. We've looked at things like food, testing, how to make sure that folks understand their rights in terms of work. And we've done a number of strategies to ensure that children can be safely schooled at home through distance learning. But are there other opportunities? Are there other gaps? Are there places and populations in our community that we need to do a different type of outreach for to ensure that they know what's available to them, especially as the packages roll down from the federal government, which James will get into in a few minutes. But we really need to recognize that vulnerable populations will become even more marginalized and often do when pandemics arise. And that supports that are created by state, local, and federal governments oftentimes are just set up in such a way that the people who need it most don't always have ready access to it. And so we want to be thinking about our response strategies, as well as how do we communicate right and informative information out to the people who need it most. And so I'm sure we can share more in the future.
I'm sure, I don't know if I missed this, but did you mention anything about GEAR and how we're utilizing information from those groups to guide our students?
I did not. So last year, about a year ago, Palm Beach County became the first community in Florida to join the Government Alliance on Racial Equity. And so we have been partnering closely with our partners across the country who are thinking about what is the role of government in responding in times of crisis. And so they have activated a COVID rapid response group on which we participate weekly. And that in that medium, they're sharing best practices from everything from education to healthcare to criminal justice to employment, so on and so forth, messaging. They're in the process of developing a toolkit so that we can make sure that, particularly for marginalized and vulnerable communities, we examine our strategies and our response systems using a racial equity lens. And so through the guidance of GARE and with the efforts and of our community partners, this GAPS work group that we have activated will be kind of taking a look at what can we do in the future, what are we doing right now, and making sure that we have a solid response, not just in the moment of the crisis, but really thinking about long term. We recognize that for some of these communities, the landscape is going to be forever changed as a result of COVID-19. And so we need to really know, well, what does that mean for communities that are already on the fringes? And we know that those are primarily Black and Brown communities. And so our process in the GAPS group is not just to think about right now, but to think about how do we sustain ourselves and how can we be more readily prepared should there be a wave 2, a wave 3, and so on and so forth. It could be Corona or something else. And so we want to be thinking about that consistently.
Thank you, Marcia. And so I just want to plant the seed that, as we are all adjusting and transitioning, that it's always important that we check in with our partners. When we talk about looking from an equity lens, we are talking about racial equity, but there are other intersections that we really have to be mindful of as well, especially when it comes to our LGBTQ community, when it comes to special needs, and when it comes to our homeless youth, when it comes to even caregiving youth and others. We have to always do what we can to look at those groups, those vulnerable groups in some cases, to make sure that 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 not only are we communicating to them in the most efficient way, but that the services that we're providing or that are being offered are reaching those individuals who need it the most. And so I bring that up because we're beginning now, and have been for the last week and a half, 2 weeks or so, to think about what's happening within our education system, where we know we have lots of homeless youth, individuals who are couch surfing. A lot of them are sleeping in hotels and motels. Some are sleeping in their cars or in the parks. And what does that look like to make sure that as we're transitioning to an online platform, obviously they're going to be at a huge disadvantage. And so how are we thinking about this? How are we approaching this? And I've had some conversations with June Esau at the school district, and Keith was on a call a couple of days ago, because we're going to get guidance from them. We want to know from them, how can we help? How can we support? We are fortunate enough to have a lot of leaders who are working as backbone entities for collective impact, whether it's in housing and homelessness, whether it's food or health and behavior health, or transportation. We have this infrastructure that has been developed, but how are we using that to support each other? And in this instance, how are we bringing all of our resources to bear to make sure that the school district has the support they need as they transition to this online learning platform, particularly for kids who are homeless? And so that's really important for you to be thinking about as providers, what you might be able to do to assist. If you operate a mentor program, are you checking in with those kids, making sure that they have the equipment they need, making sure that their families have the support they need, and utilizing your access to those families to sharing that with other parties in the community, and supporting those families through this transition? Like, think about your role and what you're doing and how you would be able to support the district as we transition through this. That's really important. And then I have Dr. Alonso that's going to say a few words, and then I want to talk about how those same families that we're serving, that you guys are interfacing with, how we need to start preparing them for the stimulus check that's coming down. So, Doc.
Marcia, thank you for your comments, very important, and your comments also, James. But remember, this is very different, and I agree 100% that this is going to change this country forever. This is not the situations we're used to where it's a hurricane and people can go somewhere. There's nowhere to go. The entire country is being affected. Even those little towns that you don't think have a lot of cases, because they're little towns, those little few cases make a huge difference. Mm-hmm. So it's not like when we had Katrina and people came to Florida and people went to Texas and they went different places. This is affecting the whole country. The other day I saw the feeding going on in Nebraska. Mm-hmm. Lines and lines mm-hmm. of cars of people getting food. That could happen here in Florida. Mm-hmm. We're not there yet because we haven't felt that yet. So we got to get ready. We got to be prepared for this. And you guys are the eyes and ears that could bend this curve so that it doesn't happen so drastically by staying on top of it. Thank you.
Thank you. And that's a great point. And as we think about this, especially we're interfacing with farm workers and many who are in the Hispanic or the immigrant community that are facing these challenges. As we're communicating information about things like what I'm sharing on the screen now, or information about how to remain safe, what options are available to assist, we really have to be mindful of sharing it in a language they can understand, making sure that we're using communication platforms. If we're in the Haitian community, I know a lot of times they're using radio. So how are we messaging our information in Creole on the radio, right? So we we just have to be strategic in our communication strategy to make sure that we're reaching all groups so that they have the information they need to stay safe and to keep others safe. So that's just important for you to know. So,
James, I was just going to chime in that, again, I think Dr. Alonso hit the nail on the head as you, that we have to have a holistic public health approach to this response. You know, from first of all, removing the stigma that COVID-19 is is an international crisis. It's certain folks we don't want to further disenfranchise our Asian community. So there's just so much work to be done. And we have to get in front of how we're describing this in language and that these things are important so that people can really kind of recognize that this is a wake-up call. Like, this thing is here. It's next door. It may be in your house and you may not even realize that it's there as yet. So a public health response is definitely something I think that we're going to push for, and a public health response that's equitable.
I see a question about receiving calls from parents who can't access the internet when they were told by Comcast they had a balance. If we're running into those challenges, just need to let one of us know. Keith mentioned on the call the other day that Comcast waived provisions where they had to have a credit card or something in order to access internet, that it is actually free. And so if you're running into challenges like that, if you want to email me, I'll make sure that it gets to the appropriate person so that they can address it. You know, just whether it's internet access, whether it's families that don't have access to transportation, only the last count we had, there were only 85% of the people who ordered computers and equipments and things of that nature from school have even picked them up. So it could be that they don't have transportation, or they don't know where to go, or there could be a number of reasons. And so we need to be the eyes and ears to provide support to those families so that our kids can continue to be educated. And as we're doing that, we also need to make sure that they're aware of how to position themselves to receive the stimulus dollars. And this flyer that I'm showing on the screen, this flyer that we have on the screen was one that Wendy sent to me today, and I just thought that it was appropriate to share, and we'll continue to push this information out. But we're working with some of our community partners to ramp up resources to try to get taxes filed. There are some individuals who either haven't worked or for whatever reason have not filed taxes in the last 2 years. And what does that look like in getting the support that they need? So we want to make sure that they can get their taxes filed, or if they don't have an updated address on the form, or a bank account, or whatever the case may be, we need to start preparing our families to position themselves so that they can receive those stimulus dollars. So I'll make sure that you guys have a copy of this flyer as well. And then if people want to get their taxes done and things of that nature, try to just take their name and their information. And once we have provisions for or those services available through our community partners, we'll make sure that they gain access to them. All right. And I see Seth mentioned that the Guatemala Maya Center has developed the video resources for their clients that's really good in their native language. And Hands Together for Haitians is looking to do the same. So yeah, we need to identify those organizations, that social network, and make sure that if they're go-to organizations for people of different cultures and different communities, that we get that necessary information to them. So thank you for sharing that, Seth.
With population getting education. Talk about that.
Yeah. So I can tell you, when I spoke with the school district about that, those are things that they were working on. We're going to have a separate call just dedicated to that particular subject, so that as we continue to organize around this particular issue, so that you guys can be aware of things that you can do specifically to support those individuals. If they are already with like Vita Nova or in the foster system or with someone, it's easier to get those individuals on board. But right now, the district is working on reconciling the list of 4,400 people, that kids that they identified as homeless within the system. You know, they don't have the online attendance. Last I heard, that wasn't something that they had as of yet, but they're going to be asking their teachers to start looking at who's coming online and trying to reconcile that, and then to look at the list of individuals who've identified as homeless to find out who's participating and who's not, and then try to address those gaps. And the same with the immigration. I mean, the Hispanic community and our farm worker community. You know, there are some issues there that need to be addressed. So we're going to have a call in the future that specifically looks at that and look at strategies to address it. And you know, we've been in conversation with the Department of Children and Families. They were on a part of the call last week. Elisa wasn't able to make it on the call today, but we're also keeping our eyes on what's happening with kids entering into the child welfare system, and what the dynamics are there, whether we're seeing an increase of calls based on this shift, or whether it's, you know, it hasn't changed much at all. And if there is an increase, you know, who is it? Where do they live? You know, what are some of the family structures or some of the dynamics around their engagement with that system, and strategizing around that as well. Marcia, I know you're on the child abuse, the plan that needs to be submitted to the state, that you were leading that effort. So maybe we can have a follow-up call around that as well in the future.
Certainly, we're working with a number of community partners to take a look at child maltreatment data. We're all very aware that for some young people, and school was their only safety net, and so now they're not in schools, or not. We may not be sure where they are, and we know that we're also we reached out to some of our DV partners to collect some data on, have we seen an uptick in requests for support for domestic violence services and supports, and trying to get an understanding of how they're supporting also a very vulnerable community who now, because of shelter in place, may be sheltered in places that are not safe. And so soon as we have a better understanding and a look at that information, we can probably have the same kind of a dedicated call, similarly to education, with those partners to hear more about their work, what they're doing. We know that all of those services are open. Our certified domestic violence shelters are open and active. And so we don't want folks to be in fear that if they need supports, that they're unable to access those in the time of this stay at home. We don't want folks staying at home in environments that are not safe and unhealthy. And same thing, the Department of Children and Families, our child protective investigators are still investigating cases of child abuse and neglect, and we want to make sure that children are safe.
Yeah. And that they're approaching this work in a safe way, that they're wearing PPE when they're doing the visits, or however they've adapted. We've had conversations around that, and we'll have more details in future calls. I just want to make you aware of the resource that was sent to me by Bob. He wanted me to share it with you. There's a resource guide. You can go to Legal Aid's website. It's translated in 3 different languages, but you know, there's going to be a need for legal services throughout this ordeal, and so just know that guide is available. I perused the website, and it's very useful information. So take that with you, and make sure that the families that you're serving, they have this information as well. And I see another question. I think Dr. Alonso answered this question about Miami-Dade's death rate. I don't know.
I'm gonna repeat it very quickly, and there are 3 things that I think is making our death rate higher. Number 1, we have a much higher rate of a population over the age of 65 and over the age of even older than that. So we have an older population, much older population than Dade. Number 2, We have a lot more people coming down into Palm Beach County, snowbirds. We have much greater, bigger communities here where people come and congregate and actually are living together as senior citizens, as plus senior citizens. And number three, there's a little bit in terms of how the medical examiner actually determines a COVID death. Our medical examiner is very precise and sticks very much to the rules in terms of a death is considered a COVID, even if it's a coincidental finding. So for example, you can have a heart attack and die, but if you're positive and the medical examiner in the examination shows that it had relationship with that heart attack, and you would be considered a COVID death as a secondary contributor, not a primary. So you can die of a heart attack and still be a COVID death. It doesn't mean you died of COVID. So depending on that interpretation and that ability to put that into the death certificate, we may be having a more precise medical examiner that's a little more sticking to the rules. That's the same as when somebody dies from a heart attack and they have diabetes and they have COPD or they're smokers. That information gets entered as part of the death record. So that is the way it's supposed to be. Not every medical examiner does it the same way. So those are the three reasons. And with that, I'm going to have to leave because I got to take care of a HR problem.
All right. Yeah, it's kind of interesting having to, run a department and to be the liaison here at the Emergency Operations Center. All right, so we're going to turn it over now to Julia, who will give us kind of an update on reemployment assistance and information on how we are still looking at our numbers and preparing for the future. Thank you.
Thank you, James. Can you hear me okay?
Yes, we can.
Perfect. Thank you. I had some technological issues to start off with, and I appreciate, James, you helping me through them. So good afternoon, everybody. So as of today, we have over 16,000 people in Palm Beach County that have applied for unemployment. We know that number is low because of the difficulty getting into the unemployment software and application at the state level. Those problems are actually being fixed. So if you grab a paper and pen, I'll continue talking, but I do have some more information for you towards the end of my conversation. If you were laid off, if you were furloughed, if you developed COVID-19, if you were told to stay home because of COVID-19, if you have children and you lost your childcare and could not work because of COVID-19, all of those are reasons why you should apply for unemployment at this time, or reemployment assistance is what it's called. Those applications are available now in paper, or you can go to www.floridajobs.org. The website was overwhelmed. They have additional people working on the website. People are starting to get through, which is a good thing. Phone banks have been opened up. People are calling Career Source for assistance, the libraries for assistance. And just recently, we made available the paper application. The paper application is 7 pages long. It's in English, Creole, and Spanish. It's available at the front doors of your career sources and the public libraries, and now FedEx offices as well, the larger FedEx offices. And FedEx is also mailing them for free if you should need that service. So a lot of people are pitching in to help the Department of Economic Opportunity and form partnerships with them to assist our citizens. So between the 3 applications that are in paper, that simply starts your application process. If you go online and you apply through the Florida Jobs website, Connect, you actually can download the information that they need, and your application starts the day it is completed. So it's important that we actually try to complete it online. Today, some very good news came down from the Department of Economic Opportunity, and that is their app. The app is fully functioning now. Previously, it was not. You were not allowed to complete an application on it. Now it is. That address is www.floridajobs.org /RA application. It's www.floridajobs.org floridajobs.org/RA application. And people are getting through and they're able to complete their application in under 30 minutes. So I'm really happy about that. That's another tool for people to apply. In the meantime, jobs have kind of dwindled. Companies have really pressed the pause button in hiring. And a lot of people are weighing whether they should work or shouldn't work, be exposed, stay at home and be safe. A lot of nonprofits are assisting with food banks and providing assistance to those people who are unemployed. Right now, the only thing I have available truly is I need about 50 CNAs for employment. So if you are a certified nursing assistant and you'd like to work, you can email g.smith@careersourcepbc.com and attach your resume if you can. We'd really appreciate that. And I'm making a call for certified nursing assistants at this time. So again, anybody who has COVID-19, been laid off or furloughed, or had a loss in wages due to unemployment or due to their loss of their jobs through no fault of their own. I should remind you, you have to have lost your job through no fault of your own. You're available and you can apply for reemployment assistance through the Florida Jobs Network. We have a working app now. We have paper applications in 3 languages, and we still have the DEO website Connect to apply for these jobs, to apply for unemployment. I hope that helps you a little bit, and I'd be glad to take any questions.
Yeah, you have a question here. Is saying if someone has reemployment application in pending status, should they be submitting biweekly claims until approval? Is the question. And that address that you gave, if you're able to type it into the chat box, that would probably be useful.
Which one? One for the app?
Yeah, the one that you gave out.
I got it. All right. If you have an active account in the reemployment assistance, is that what your question was?
Yeah.
You still have to file your claims?
Right.
Yes, you do, but you have a week to do it. So start on Monday. By Friday afternoon, it should be in the system.
Okay, thank you. Any other questions for Julia before we move on to the next? Okay, I just wanted to share this with you. It's something that Elisa asked me to share. Basically, the best way to get information on what's happening with DCF is to visit their COVID-19 information site at myfloridafamilies.com. And then you see the link there, COVID-19 access. So if you want to get the most up-to-date information about what's happening, you can visit DCF site and receive that. Now I want to just turn it over to Julia Creepo, who can give you an update on what's happening with hunger. And this is a partnership. I apologize for not having this on the slide, but our, hunger relief efforts, we have that collective impact model that's going there as well. And Julie serves as the vice president for hunger relief with United Way. She works in conjunction with Feeding South Florida and the Palm Beach County Food Bank to make sure that food is distributed to all of the pantries. I think there are still about 80 that remain open. She'll provide that information. And making sure that the pantries are continually stocked. And when there are businesses or restaurants or grocery stores that want to donate, that they're directed in the right location. So Julie, if you're on, I thought I saw you earlier.
Yes, I'm here, James.
Yeah, so you can go ahead and provide an update on what is happening in the food and hunger world.
Thank you, James. Can you hear me okay?
Yes, we can.
Great. So James touched on what we're working on, and I'll expand on that. We're partnering with community partners within and outside our network, actually, some that we've never partnered with before, which has been very exciting and worthwhile. We're looking at addressing the short-term, mid-term, and long-term needs of our communities here in Palm Beach County. all the while staying nimble so that we're actively identifying needs, addressing those needs as they arise, and also preparing for any expected and unexpected needs that we might find that are out there, and then create solutions by bringing partners together, as James said, with the collective impact model. We're tracking information that's available through our networks, data, through WebEOC. We're tracking pantries that are closing. James is right. There are about 80 food pantries that are open now. About 41 have closed so far, mostly due to social distancing concerns. We work very closely with Palm Beach County Food Bank, Feeding South Florida, Area Agency on Aging, and the super pantries, I call them, who are some of the large pantries that can really move food quite well through the community, and all working with those smaller pantries that are at the grassroots level in their neighborhoods. We're working also very closely with the School District of Palm Beach County, Flippany, Feeding South Florida, and the Boys and Girls Clubs of Palm Beach County. They have what's called break spot sites. That's available to families and children 18 and under. It doesn't have to be school-age children. People can go to 211 to find the sites that are closest to them. They can also go to the school district website. And they can, in addition to that, text FL Kids Meals to 211-211 or call 211. There's also a website called Summer Break Spot Fresh from Florida. If you just Google Summer Break Spot, it'll take you there. You type in your address and it'll give you the site nearest you. So those break spot sites are really key. There are 35 schools right now and 22 Flippany locations. There are 7 Boys and Girls Clubs location, and I believe 7 Feeding South Florida sites around the county. So it's more than 60 plus sites that are out there to help families. They're serving meals. Some are serving lunch and breakfast. Some are serving lunch and a snack. The school district is doing a grab and go. I shouldn't say even serving, they're making available in a grab and go model where cars pull up, they put the food in the people's trunks, and they move along. They just started this week, not requiring parents to have the children with them, as long as the parents can show that their children are registered in the schools or have children of other age, they can get those meals. I'll just share with you some of the numbers that have been distributed since the coronavirus pandemic began. The school district, in the 3 weeks since the beginning, they started this when school closed, has served more than 426,000 meals. That's not the highest number because they're still waiting for some numbers to come in. And so that number represents multiple meals that are served at once that are with the grab and go model. So the average number of children served per day is just about 10,000 kids. It's 9,975 children. Feeding South Florida has distributed food boxes at these 35 sites. The first week of March 16th, they distributed at 30 sites. It was 1 food box per family. The week of March 30th, they distributed 1 food box per family at 35 sites. This week and the week of March 23rd, they did not distribute, but they will be back next week, April 13th, distributing to the 35 sites, again, 1 box of food per family. And that schedule is also on 211, but in addition to that, on the Palm Beach County School District site. And you can also check Feeding South Florida's website for that as well. The easiest thing to do is either go to 211 or Palm Beach County Schools, as they've got a listing of more than just Feeding South Florida. So you can get your information there all in one fell swoop. The Flippany grab and go sites, which Hunger Relief helped them, our team, to find in my request of FDACS, Florida Department of Agriculture and Consumer Services, to go a little deeper into the community so that we can reach folks who aren't able to necessarily get out in their cars to pick up meals. Again, this is a grab and go model. So we're working in various parts of the county, in the Glades, as well as the eastern sites. There are a total of 22 sites, and Flippany is serving more than 3,500 meals, not dollars, 3,500 meals a day for an average of 160 meals per site per day. Boys and Girls Clubs, and they see this growing every day, just for everyone to keep that in mind. Boys and Girls Clubs are serving at 7 of their sites an average of 143 meals a day, 7 days a week. And that's for the club members and their families. And however, the kids can, if there are siblings or whatnot, any child can get meals from them as well. So they're serving about 1,000 lunches and snacks a day, 7 days a week. Again, that's all on 211's website. For seniors that need food, they can call the Elder Hotline. The Palm Beach County Senior Centers are still being used as distribution sites. I talked about that last week, and PalmTran is continuing to deliver food to the homes of the seniors. And also, certainly, seniors can call 211, but the Elder Hotline is accepting calls. I think there's going to be a press release coming out soon about all seniors calling that helpline. Just again to reiterate, anybody who is in need of food outside of what I've just talked about should contact 211. They get the frequent updates about the pantries that are open and with locations for the food.
Thank you. Thank you very much, Julie.
You're welcome.
So now we're going to just hear if we can get some quick updates from some of our community partners. Taruna, if you're still on, I'd like to call on you to talk about some of the things that we're starting to look at as it relates to emergency services. And then we'll hear from Ann Berner, who's on the call. She can share some information in our behavioral health world and that she feels would be helpful. And then I think we have Seth and Randy and Tammy and a few others. If you want to just take a few minutes to share some updates, we'd appreciate it.
James, Taruna has left the call.
Okay, so I'll just share that we are making some tweaks to some of our FAA agreement or requirements and some of our program requirements to make it easier for you to access services for some of our clients to access services. We're going to give you more details on specific changes that we'll be making on a future call. But I know that there are some organizations that are doing similar things. So we'd like to hear from you as well if you're making any shifts or changes or waivers, having waivers to some of your eligibility requirements. Please let us know so that we can share that with the other partners. So Ann, if you want to go ahead and share, we'll hear from you.
Sure. Thank you, James, for letting me just provide a quick update. We continue to work on expanding our capacity to do telehealth and have had some clearances from a number of the licensing authorities. So a number of our providers still are taking new clients and new admissions and doing that through their telehealth platforms. We're working with 211 to make sure that they've got the providers that are actively taking new clients so that they can give out current information. And then we continue working with a number of our providers around the homeless and coordinating services related to behavioral health. Our mobile response teams are continuing to respond to calls in the entire county. And again, they can be accessed through 211. They are trying to do some of that work, through telehealth, but they are able to respond on location and continue to work with our emergency rooms as well. As I mentioned previously, 211 has a COVID-19 website that we are working to make sure we vet that information and make sure that it's current, so that anyone who's accessing those resources has a good and live point to go to. And then we continue receiving calls through my office on special cases. We're coordinating with the courts and trying to keep some of the the real high-end individuals safe. And so a lot of that work continues, even though we are all isolating at home. But thank you for an opportunity to update Palm Beach County.
Thank you. Thank you. Tammy, I think you were on the call. If any of our Birth to 22 representatives want to say something, Seth, Randy, you guys feel free to go ahead.
James, this is Randy. The part of Birth to 22 that involves the funders coordinating with each other. There is the COVID-19 funding application that's been online now for a few weeks. We have received overwhelming number of proposals, over 370 proposals requesting almost $20 million. Some of those have been funded. I think over $2 million has been funded to close to 70 organizations, but as is obvious from the numbers, the need for funds, I'm sure, far outweighs our ability to fund those programs. Community Foundation and United Way both do have funds, and certainly any encouragement for folks to donate to those funds, those dollars are going to those applications as the funds are received. And we continue to add different foundations and other funders to that group. It's up to 9 different organizations. But if organizations that are on this webinar applied, rest assured that they are being reviewed as fast as people can. Decisions are being made as fast as they can. And there's no need to necessarily follow up. You will hear from one of those funders if they're moving forward to try to fund your organization.
Thank you. Thank you.
James, can I say something? Can you hear me?
Yeah, we can hear you.
Thanks so much for doing these sessions, James. They're extremely helpful. Hello, everybody, and thanks, Randy, for that overview of our Disaster Funders Coalition work together. It's really quite a pleasure working with our co-funders around this extremely challenging time. We've done it before, and we were ready as soon as the situation hit our community. But just from United Way's perspective, as Randy said, we have made some allocations. We've already offered $250,000 to 17 nonprofit organizations, and like Randy said, each of the organizations are reviewing applications each and every day, and we're working quite hard. We got our Donna Quinlan and Community Impact team that is really reviewing them carefully, and we're really looking at the biggest needs first with basic needs, and as Julie and everyone talks about, access to food is certainly one of them, and access to other basic needs, and supports for the organization to have them keep their doors open. As I said last time in other conversations, we really rely on our nonprofit community as businesses working now, to help our communities that are most in need. So, we're here for the community. We want to hear from folks about their needs, and one way to do that is through applications to this fund. So, we really appreciate the nonprofit community and the partnerships with government and other businesses, and we'll continue as a community to work together and come through this on top. Thank you very much.
Thank you, Seth. Any other comments from any of our partners?
James, this is Julie again. I wanted to definitely share 2 things, if you don't mind, very quickly.
Right.
This is about the EBT, the PEBT they're calling it. So we're monitoring right now a partnership between DCF and FDAX for PEBT. It's not established yet, but it's expected to be this month. And when it's established, the clients will be able to file an application through the FDAX website, and then FDAX will process that. So along with, for folks that need that, it'll run concurrently with the school districts and their school lunch program, and those that are receiving PEBT will be able to receive the school district meals. So I want to make sure people know that that's coming, and it will be administered and loaded by FDAX working with DCF. And lastly, I wanted to mention, which I didn't in my last update, just because I think I ran out of time, was that Hunger Relief is also working with the Area Agency on Aging to develop and vet their agency pandemic response plan for seniors. So that's coming as well. Thank you.
Thank you. Thank you very much.
Thanks.
All right. So I don't see any other panelists that are looking to provide comments. So I just want to remind you that we'll be doing these calls weekly. If there's information that you need to share, any updates, please share it with 211 Disaster. Please share it with us. You can email me directly at jgreen1@pbcgov.org. And if there's a particular topic that you feel strongly needs to be discussed and organized as we move through this pandemic, you can let me know that as well, and we'll see what we can do to integrate it into our agenda. All right, so I just want to thank each of you for participating on this webinar. Thank all of our panelists and our community partners who shared updates with us. I want to encourage you to continue to stay safe, continue to adhere to CDC's guidelines of social distancing and washing your hands. We're going to be sharing some information during the next call about how essential workers can continue to keep themselves safe and making sure that we're providing the most up-to-date information about what's going on with COVID-19. I think that part of our agenda earlier was to talk about some of the additional symptoms that they've added to the list for COVID-19, but I don't know if we hit on that enough this time. We'll have to pick that up next week. So with that, I just want to say thank you to each and every one of you. If you have any additional questions, comments, concerns, please let me know. I do see one there for Julia in terms of a job search that applied the claims. They couldn't submit because there were issues with the site. I guess too many people were logging on. I think Julia mentioned earlier that some of those hiccups have been addressed and they're able to utilize the site. So if that continues to happen, please let us know. And in terms of masks, those are very difficult to come by right now. I think we have an order at the EOC, but all of our masks are going to our essential workers who are interfacing with clients. You guys have seen news on what's happening in John Prince Park, just changing the subject very quickly, because I know that this has been on the news quite a bit. There are two things that you should know. Number one, we're still moving forward with the Fairgrounds Road facility. So the board will be hearing about that contract with Goodwill next week. And then the second thing is we're taking every provision to make sure that John Prince Park and other homeless individuals are safe. We've moved the tents 12 feet apart. We've added showers and sanitation stations. We've put barriers up so that people can't just drop off clothes or food when they want to, because they could be trying to do something good, but spreading the disease. So we don't want that. But just know that we have people here at the EOC that are monitoring that situation, along with staff and other members of the Homeless and Housing Alliance, as well as people who we're isolating due to COVID-19. So just know all of those things are happening here, and that is, we're not forgetting about our homeless youth and families throughout this pandemic. With that, I just want to say thank you, stay safe, and we'll see you next week.
Okay, James, I think that went pretty good.